COVID-19 related illness. On average, someone lost their mother, their father, their sister, their brother, their grandmother, their grandfather, every 2.5 days throughout the month of August. 12 of those people died while they were hospitalized, and because of visitor restrictions imposed due to the large number of cases, many families didn't get a chance to say any final goodbyes to those 12 people. Tragically, today, we announced 2 additional deaths, a man in his 70s and another man in his 90s, each of whom passed away in our local hospitals over the last 2 days. 2 deaths in 2 days. Yellowstone County's total deaths due to COVID-19 related illness stands at 45, which is 40% of all the deaths in the state. With just a few days into September, we are not trending positively. Just 3 days in, we've already reported 117 new COVID-19 infections, and a total of 2,200 Yellowstone County residents have been infected. It's been a rough few months, and it's still looking rough. Let's talk a little bit about where we are with case investigation and contact tracing. As you can imagine, the large number of new cases in August continues to stress not only our healthcare facilities, but also our public health capacity. Because our numbers are trending upward, in the last month we've hired about 100 temporary part-time staff members at RiverStone Health to help with case investigation, contact tracing, testing, screening, data entry, and data analysis. As you know, we report 8 benchmarks that help us with COVID-19 decision making. This morning, 6 of those benchmarks are yellow, 1 is green, and 1 is red. Over the last week, our benchmarks in Yellowstone County have been trending worse. On average, each new positive case we investigate has 3.5 close contacts. With more than 1,000 new cases in the month of August, conservatively, that equates to nearly 3,700 people who have been exposed to COVID-19, just from those 1,000 cases. Because of the high number of people infected in August, we have not been able yet to reach all of them. But of the 642 people that we have reached, we've also reached 77% of their contacts. Collectively, more than 3,600 people were either isolated or quarantined at some point in August. And that's just from the people we've been able to reach. We're working every day to reach the remainder of the people who were infected. If you've been infected, I'm asking for your cooperation. Please answer your phones, and if your voicemail isn't set up or it's full, please set it up or empty your mailbox. We're hearing rumors that some people have said they will not disclose all their contacts to avoid people being placed in quarantine. Quarantining close contacts so that they do not infect others is one of the key measures we can take to slow the spread of this novel coronavirus. If we have to call you, please answer and be fully forthcoming about your contacts and activities to help us protect others. Also in the month of August, we analyzed 751 closed charts. For various reasons, like an inability to reach those infected or the refusal of people to participate in our investigations, we were able to interview nearly 80% of those infected, or about 600 people. Here's what our analysis shows. 90% of the people we interviewed were symptomatic. Almost 25% of those were infected through a household member, and nearly 31% were infected by a known non-household member. About 44%, or 261 of those interviews, could not identify a known contact. They couldn't identify someone who was known to be positive that they had interacted with. Of those people with no known contact, during the 2 weeks prior to being diagnosed with COVID-19, here's what they told us. 64% of those had been to work. 51% had been shopping. 27% went to a restaurant or a bar. 22% had traveled either in-state or out-of-state. 22% said they had been to an informal family gathering or camping or a barbecue, or a formal affair like a wedding or a funeral. And 5% attended a public activity like a rodeo, concert, or other activity. What these numbers show us is what we know. People are more active and going more places in August than they were in July. Now it's September, and most county schools have begun in-person instruction. And with that, we fully anticipate seeing more cases. Before I talk more specifically about the conversations I've been having with school superintendent and athletic and activities directors, I want to ask Karen Graff, our school nurse manager, to talk about COVID-19 spread in the schools. Karen, podium is yours.
Two girls giggling on the playground together. The screech of first-time violin players attempting to make music. A janitor softly humming as he completes his midday cleaning. And kindergartners reciting the days of the week. Yesterday, as I worked as a school nurse in one of our county schools, these are the sounds that I heard. 10 months ago, those same sounds would have seemed like noise. But yesterday, those sounds were music to my ears. Yellowstone County students are back in school. In Montana, each school, public and private, developed individualized reopening plans and processes for implementing them. Schools recognize the importance of providing safe, in-person learning, but have found it difficult to address the complex situations that have occurred, let alone anticipate any future challenges. Staff and students, I observed, are doing an amazing job adjusting to those plans. They're wearing masks, they're watching their distancing by staying in their pods or their cohorts, washing hands frequently, and opening windows for good positive airflow. Other sounds I heard yesterday, a student with a frequent cough and shortness of breath. Is this COVID-19 in our school, I wondered? I have asthma and I really need my inhaler, was the request of this preteen. Still, I wondered, is this COVID-19 in our school? I know students with asthma can get COVID too. Good nursing skills, an asthma action plan that had been signed and completed by the healthcare provider, and good communication with the parent helped keep this student safe and in school. Later in the day, a student reported a headache to me and further an upset stomach. Again, I questioned, is this COVID-19 in the school? A phone call to the parent revealed that this student manages their emotions with physical complaints. After a 2-minute reassuring conversation with the mom and a 5-minute rest on the cot in the nurse's office, the student went back to class saying, I feel all better. Parents, it's important that you know what is normal for your child. So be aware of symptoms of stress or anxiety or what might be a symptom of COVID-19. And lastly was the sound of the parent calling to report that their vacation to visit extended family before school started had resulted in a positive test in their household. Possible other context to that one single case included multiple workplaces, a daycare, several schools, sports teams, and other social circles in 2 Montana counties. The parent quickly made arrangements with the school for online learning for their children's 14 days of quarantine at home. Yes, COVID-19 is in our schools. We've seen it in our students, our staff, and our parents. So as schools have reopened over the past 2 weeks, positive case counts have continued to rise, as John just mentioned. As of September 1st, Montana has reported 329 cases of COVID-19 in children under 10 years old, and 735 cases in youth aged 10 through 19. By taking reasonable steps to prevent the spread of this virus, all of us are helping to protect ourselves as well as others who may be at more risk. We all need to do our part. So join with our school nurses as we work to keep our students healthy, safe, and ready to learn in school. Wash your hands, wear a mask, watch your distance, open windows and doors for airflow, and most importantly, when sick, please stay home. Let us as a community work hard to keep hearing the sound of active, thriving schools with staff and students in the classroom. Now, John.
Thank you, Karen, for that overview and for expressing how quickly COVID-19 can spread within the school environment. I know many parents appreciate learning more about the important role of school nurses and will heed the tips that you provided for keeping our children well and in school. With just a few weeks into the school year for some of our schools, we are already seeing COVID-19 in multiple schools, in multiple districts, involving both students and school staff members. At a Sunday, August 23rd press conference, I announced 4 indicators that we would look at on a regular basis to determine how we go forward. I'm meeting weekly with school superintendents to review how COVID-19 is impacting in-person learning. Yesterday, I shared with our current status for these measures with superintendents of the school districts from across the county. Today, I'll share them with everyone else. The 4 indicators we are using have definitions for green, yellow, and red status. Overall, with respect to these school-based indicators, we are in yellow status. We have 2 qualitative indicators for continuing in-person learning, and here they are. First, healthcare and public health capacity. And secondly, looking at case clusters and the percentage of cases in people under 19 years of age. Our 2 quantitative indicators are the biweekly rolling 7-day average of new cases per 100,000 people and our weekly Yellowstone County COVID-19 test positivity rate. The case cluster and percentage of cases in people under 19 is currently green, but is trending worse. Both healthcare and public health capacity and the biweekly rolling 7-day average of new cases per 100,000 are currently yellow and trending worse. The weekly Yellowstone County COVID-19 test positivity rate is red, also trending worse. Overall, about 10% of the people who've been infected with COVID-19 in Yellowstone County are age 19 and younger. That percentage is one that's remained fairly constant in recent weeks, but with school back in session, it's one that we're very carefully watching. Also, to help monitor the situation in schools, we're working with Karen and our school nurses in contracted districts, as well as other staff in school districts in Yellowstone County, to help us with case investigation and contact tracing. Those not employed by RiverStone Health will be deputized and trained to help ensure privacy is maintained while helping us identify close contacts more rapidly. In addition to meeting with the district superintendents in the county, before school started, I met with school superintendents and athletic and activities directors. Together, we came up with a county-wide plan to help them mitigate the risk of COVID-19 infection for students that participate in sports and other activities. Our first priority then, as it remains today, is to keep students in school while providing them opportunities to learn and grow outside the classroom. As you are well aware, this plan has not been without controversy. However, when the plan was developed, it was widely supported by the team that developed it, and we all made efforts to comply with the directives set forth in that plan. In recent conversations with athletic and activities directors, each agreed that in theory, having a single plan for Yellowstone County seemed like a good idea at the time. Our experience with COVID-19 has been consistent. We start with a plan, learn from experience, and adjust the plan as we learn more. With the experience we've gained, all districts and athletic directors now believe that with the number of different classes in the county and with the variability of resources and needs, it would make more sense for each district to develop a plan for activities and athletics based on the class in which it participates and its own resources, and in order to have some more consistency across the classes and districts. Therefore, I am today rescinding my health officer order dated August 18th. Each school district is now responsible for making its own plan to manage athletics and activities. School districts are working on plans now, and as we have done with other plans that have been submitted to us, we will review and offer feedback. To be clear, we do not approve of plans, but we provide feedback, recommendation, guidance, and help them make sure that all the appropriate issues are being addressed. In addition, districts are responsible for compliance with the governor's directives. I also want to make clear that the rallies, the social media posts, or numbers of signatures on petitions did not play into the decision to rescind this health officer order. All the calls, emails, and other communication that we received about the initial plan were read or listened to and logged. Public opinion is important, but in the final analysis, thoughtful discussion, the confusion about inconsistencies within conferences, and the uniqueness of each school district led to the decision for districts to make their own plans. Before we get to your questions, I want to spend just a few minutes updating you on the situation in our senior living community facilities. On July 3rd, I issued a health officer order temporarily restricting visitors to senior living facilities, including but not limited to skilled nursing facilities, assisted living facilities, memory care facilities, and adult group homes. That order made an exception for compassion visitation at end of life and required all compassionate visitors to wear a mask at all times when in the facility. At the time of issuing that health officer order, there were nearly a dozen COVID-19 positive cases in 7 senior living care facilities involving both residents and staff. Over the last 2 months, we've seen that number grow from 12 to 186 cases in 10 facilities, resulting in 23 deaths, 17 of which were associated with the outbreak of COVID-19 at Canyon Creek Memory Care. With the exception of 4 facilities, including Canyon Creek with nearly 100 cases of COVID-19, positive cases have not been in the double digits, and we feel that the mitigation strategies of the governor's directive for these facilities to continually test staff and residents for COVID-19 are having a desired impact in keeping cases low. I would like to very publicly thank our senior living communities for their commitment to keeping their residents and staff as safe as possible, and for their diligence in carrying out the mitigation and containment strategies. The leadership and staff of our senior living communities deserve our gratitude for their vigilance in protecting many of our most vulnerable citizens. Therefore, today I'm amending my health officer order of July 3rd to allow for outdoor visitation, provided there are no active cases of COVID-19 among staff or residents, and that the following conditions are strictly adhered to. Compliance with any current governor's directive related to visitation. As I said, outdoor visitation only. In cases where the resident cannot physically move outside the facility, visitation can occur through open windows with the resident inside and the visitors outside. Visitors must remain at least 6 feet from the resident and each other at all times, and visitors must be masked at all times. Residents must be masked unless their attending medical care provider indicates in writing that masking is clinically contraindicated, in which case a barrier such as plexiglass of at least 6 feet wide and 6 feet high must be placed between the resident and any visitors. Visitation cannot involve any person, resident or visitor, currently under quarantine or isolation restrictions. And the facility must screen each visitor for symptoms of COVID-19 prior to the start of each visitation experience. This amended health officer order continues to allow for indoor compassion visitation at end of life and continues to require all compassion visitors to wear a mask at all times while in the facility. This amended health officer order will go into effect Monday, September 14th, in order to give our senior living facilities an opportunity to be prepared to comply with all these requirements. So, in wrapping up, we've covered a lot of ground today, but before I get to your questions, I want to remind you that RiverStone Health continues to provide free drive-through testing on weekdays from 9 a.m. to 12:30 p.m. in the parking lot of the Shrine Auditorium on Broadwater. This testing is available only to people who have symptoms of COVID-19 or have been notified by RiverStone Health that they are close contacts with someone who has tested positive. In the absence of a vaccine for COVID-19, mitigation and containment continue to be our key public health strategies. We have a few tools in our mitigation toolbox: wearing masks, maintaining distance, washing our hands, disinfecting high-touch surfaces, and staying home when we are ill. As I've reported, our numbers are trending upward, but if we each do all the things we can to help us stay well, over time, we will see a decrease in cases. Mitigation is particularly important as we face the long Labor Day holiday weekend. About 2 weeks after the 4th of July, we saw an upward trend in new cases. Let's not repeat that after the Labor Day holiday. Thank you all for coming, and I will now take your questions. Yes?
Yeah, do providers have all that they need to quell outbreaks?
I'm not sure what your question is. There is no definitive treatment for COVID-19. So the way you stop outbreaks is through isolation and quarantine. You remove people who are ill and potentially could become ill. There is no definitive treatment, though, from a provider perspective to treat the disease.
I mean to say, do you have all the personnel and all the beds and all the resources that you need at hand to tackle an outbreak should there be one?
So, as we said, on the public health side of things, the system is quite stressed, although we continue to hire more people. That's for the testing, contact tracing, case investigation. Our hospitals have been quite full. They have not had to turn anyone away. They've not had to close or anything like that. So we still have capacity to take care of patients. We still want to make sure that people who need hospital care go and get that care. There's capacity to provide that. We continue to watch very carefully the region. In most days recently, fewer than half of the COVID-19 patients in our 2 hospitals have been from outside Yellowstone County. So we pay very close attention not only to our county, but to the entire region. Yes?
I have a financial question. You said you've hired 100 part-time employees. Do you know, like, ballpark, how much that's costing?
I don't. Right now, the most important thing is that we take care of the community. We get the people we need. There have been resources made available through various federal funding for COVID-19, some of the funding that's come through the state, and also some direct federal funding. This is one of those situations that the first thing you do is you make the decision of what you have to do to take care of the community, and we kind of sort out on the back end how it works financially.
You said we're trending in a negative direction, yet we're rescinding or lessening your orders. Does that jive with each other?
So what we've seen on particularly the long-term care, is we've seen a significant reduction in the number of cases. So that one recognizes that the long-term care population has seen that reduction. With respect to the schools and the athletics, I'm guessing is probably what you're speaking of. There's a number of mitigation strategies that are in place in terms of how the teams are working. I have been very candid. Anytime people gather, it makes me nervous. I am taking people at their word that we've heard from. I've heard from many family members that they will do everything they can, masking, distancing, to keep their children safe and to keep each other safe. I'm going to take them at their word that they will do that.
I asked you at the end of July what your crystal ball was for August, what's your crystal ball for September?
You need to find a new question. No, I'm pretty anxious about September, quite frankly. We know that schools are places of congregation. Places of congregation are where the disease spreads. I think when I look at the plans that our schools have put in place, some things that Karen talked about, they've worked really hard to cohort their students to reduce the likelihood of spread to a large number. They've changed a lot of their processes in terms of how rooms are organized, how lunches are organized, how recesses are organized, how daily schedules are organized. So I think those mitigation steps and prevention steps have been well developed. It still makes all of us nervous when you congregate people. What we also see, though, kind of on the flip side, is fewer people will be traveling typically. Once school gets in session, there's less travel. So that sort of militates a little more towards the positive. I look forward to the day that I stand before all of you and say, last month was better than the previous month. We'll see how we go. Fortunately, at this point, although we do have cases in multiple schools, what we've not seen, and the reason that one metric is still green, we've not seen large outbreaks. We've seen sort of a case here and there. I think people are very sensitive to that. So I'm hopeful that people will be very careful. But September makes me nervous. Let's just say that.
Can I ask how many cases have been tied back to Yellowstone County schools so far since they opened?
I don't actually have the number of cases that are specifically to schools.
Okay, and I was wondering on those 4 indicators, if all are trending worse and one's already in red and 2 are in yellow, is that an indicator for you that a return to remote learning may be on the horizon if these numbers don't go down?
Yeah, the way that those metrics are set up is that if 3 of them turn red, and then that is also analyzed by our medical technical team, that would be an indication that we should be looking at return to remote learning. I would say there is some analysis that needs to happen. Let me just give you an example. If there was a large outbreak in let's sort of think the unthinkable. Let's say there's a large outbreak in a congregate facility like a jail or a long-term care facility. That could certainly drive up a number of, or 2 of those measures in particular. One, the new cases per 100,000 per day, and the test positivity rate. There still needs to be an analysis by the professional team as to whether that really impacts schools. So it's not an absolute. This is really a matter of following some leading indicators that tell us how things are going. Now, if we saw significant increases in the number of people aged 0 to 19 who were getting ill, that would certainly be more directly impactful on decisions related to school.
And then I have one more question. It sounds like there's a little bit of a lag just because of the amount of cases and being able to get in touch and do case investigation on all of them. I'm wondering if you think that that system being overwhelmed is contributing to these added case numbers every day just by not being able to get in contact with them as quickly as you'd like to, I'm sure.
Yeah, that's certainly a concern that we have. It's pretty hard to say specifically, but what is also really difficult is the number of times we have that people will not answer their phone, or we can't leave messages, they don't return messages. So we're all trying to do our part. We're hiring more staff to try and build that up. We're working with schools to try and build that capacity. So we need to do our part to make that happen more quickly, and we need people to help us as well. But it's certainly a concern. If we can't more quickly get to case investigation and contact identification and notification, that creates more risk for our community.
John, talking about creating risk for our community, I wonder if you could speak a little bit to what extent Yellowstone County is creating risk for the rest of the state right now. I know you had mentioned in July that cases had been connected to Yellowstone County and I think 13 other counties and 2 reservations. Is there anything more you can tell us about to what extent Yellowstone County may or may not be driving cases throughout the state?
That came out of a analysis that was done at the State Health Department, and I've not seen a repeat of that analysis. That's a really good question, and I think one that we'll try and connect with our state partners and see if they've repeated that analysis. But I don't have anything current on that since that report came out in July.
Okay. I think just on a similar note, it's been touched on, and I think it's very much implied. But I mean, correct me if I'm wrong, but the presence of the virus in a community is the greater the presence, the harder it is for these mitigation measures to be effective. Is that right? I mean,
well, I think, yeah, when there's more virus circulating, certainly there's higher risk. What it really says is we need to be much more vigilant about those basic prevention measures of, first of all, maintaining distance, then masking, hygiene, and then keeping away when people are ill. But clearly, when there's more virus circulating, it's more difficult to slow down.
Do you think that the high rate of virus spread in the county compared to elsewhere in the state, I mean, is that due to attitudes about science or medicine or perceptions of how this is working? I mean, any other insight into why we're seeing a worse situation here than elsewhere in the state? I mean, I know there's obvious answers like population, but I wonder if there's anything else you can tell us about why this is remaining on a bad trajectory.
You know, I really can't speak to people's motivations for what they do, and why people choose to follow those really simple mitigation strategies and others choose not to. What I do know is the best chance we have to slow it down is for each of us as individuals to care enough about our community and the people around us to do everything we can to slow down the spread of the virus. And it's those simple measures I just mentioned. But that fundamentally, we all need to make that decision that we're going to do our individual parts to help our community. The why I really couldn't speak to.
Okay.
I have one other one. So I've heard about at Canyon Creek School, there are some fifth graders and their siblings having to quarantine. Can you tell us anything about that? How many students it involves, or?
No, I don't have any specifics on that. And we have to be really careful when we start talking about places where people can be easily identified, like in small sites. So we're going to be really cautious about any information we give out in particular settings. So what is true, and this is easy to say, what is true is that there are people throughout our area, throughout our county, in multiple districts and multiple schools who have been placed in isolation and quarantine.
John, I just had one more question. I don't know if this is information that RiverStone is tracking right now, but I know that there have been reports throughout the country of people who are suffering with issues that linger long after they're considered recovered. I think some terminology refers to them as long haul patients. And do you have any idea to what extent there are people in our county that are considered recovered but are still struggling with health issues related to COVID-19?
Yeah, that's not something that public health would track directly. Certainly we have anecdotally heard of a number of those people who have been recovered but continue to struggle with lack of energy, difficulty with endurance, some of those other longer term symptoms, but it's not something that public health tracks directly.
Okay.
Do you think there's enough testing being done to know where the cases are?
So we're pretty aggressive in Yellowstone County with testing symptomatic people, and we encourage symptomatic contacts to get tested as well. And we can test other contacts who are asymptomatic as well. The challenge for us has been the limitation on asymptomatic or surveillance testing. Most of the surveillance testing that's happening in Yellowstone County is in the long-term care facilities through their requirements for testing. If we could have access to more throughput, it's not the inability to gather the test specimen. The issue is we need to make sure that we continue to build throughput capacity so that we get timely results. You'll recall a while back we were receiving results 2, 3, 4 weeks later. That would really be helpful, because then we would have a better sense of what does the asymptomatic population look like. The other asymptomatic population that we are able to test are those who are getting ready to have procedures at our 2 hospitals. And I recently ran this analysis out of the tests that were done, some 2,500 or 800, I don't remember the exact number. There were 50 positives for those pre-procedure asymptomatic tests. So that was about a 1.7% positivity rate in that population. Until we have adequate throughput capacity to get timely results, it is difficult to get a real handle on what's happening community-wide, because we're testing the population that's most likely to be positive.
Really quick follow-up on Mike's question. Can you explain how somebody is officially deemed recovered? Is that a second test? And are there enough tests for those people?
Yeah. So CDC has a definition of what a recovered person is. And there's two different ways it can be evaluated. One is what's called the test strategy, which is what you're talking about, so you get a negative test. CDC has recommended that not be the primary metric used because many people will continue to have, will show virus for even months after they're fully recovered, be completely asymptomatic and fully recovered. So what's used is what's called the time strategy. So in order to be considered the case being resolved, the person needs to be at least 24 hours without fever in the absence of the use of any fever-reducing medications like ibuprofen or acetaminophen or aspirin or anything like that. And they need to have some significant improvement in their respiratory symptoms, and they need to be at least 10 days since the onset of symptoms. If those three conditions are met, then the person is considered recovered and they're released from isolation. The occasional person we have who is tested asymptomatically and found to be positive, if they never develop symptoms, then they're considered recovered 10 days after that test was obtained.
And do you know if all 56 counties in Montana use that same strategy for recovery?
Yeah, that's the CDC recommendation. So that's what I think probably everyone is going with.
Thank you.
If I could just follow up on that testing question that was asked a short while ago here. You talked about the importance of throughput. Do you have any idea if that's going to improve? What specifically is what you're looking at, what needs to change for us to be able to improve that and maybe get back to some of that surveillance testing that has been helpful in the past?
Yeah, it's one of those things that's sort of multifactorial. So the tests that are going to the state public health lab, the state has identified several contracts that they put on. They've added MSU and Bozeman. They've added the North Carolina MACO contract. And then, of course, Quest ceased in July. So as the state continues to find labs that can run those tests in a timely fashion, that will help. The other piece is related to rapid testing. And quite frankly, if we had easy access to a very large capacity for rapid testing, that would be the way to do surveillance testing. You would test a big population. You'd know very quickly how many were positive. The issue with that is for our two hospitals that do have rapid testing capacity, they've had difficulties with getting reagents and the test materials, and that's slow. That's been a limiting factor. RiverStone Health has actually ordered 4 rapid testing machines, and we don't even have a date certain delivery, but it looks like it's going to still be at least several more months because of the demand. So we need to be able to have the rapid testing platforms and the materials to do the testing, and that would really make surveillance testing much more effective. Again, surveillance testing is difficult if you test a bunch of people and you don't find out what the result is for 2 or 3 or 4 weeks. It's not very helpful.
Mm-hmm. Yeah. Is there any reason to believe the reagent supply situation could improve in the near future?
I don't know about the near future. I know that certainly the manufacturers of those are well aware of that there's a very high demand. I really don't know what it takes to spin up capacity. I'm